I
Okay.
think we should start, and they would be
Fine.
on shortly, okay?
Very good. So I'm going to
Okay,
start.
I'm gonna hit the recording 5 seconds after you hear the announcement.
Oh, okay.
You can
Right.
start, okay? Interpretation. Mr. Nolan, you can start.
Okay. Good afternoon, everyone. My name is Robert Nolan. I'm the chair of the Community Relations Committee, and this meeting is called to order as of a few minutes after 5 on today, the 2nd of March in the year 2021. I'd like to let the board know, remind the board, of course, we met on January 12th of 2021, and the minutes taken from that meeting have been circulated to the entire board. So I hope that you've read them all. I'm going to ask for a resolution from the floor to adopt the minutes of January 12th, 2021. Do I hear such a resolution?
So moved.
Motion to adopt.
Okay, and do I hear it seconded? Are there any questions at all from any of the committee members?
I have a question, actually a comment. Jackie Narine, I was actually present at the last meeting, and
Okay.
it's written out that I'm excused, so I just want that correction to be put in place.
Thank you for letting us know that. Kalisha, that will be taken care of.
Yes, Mr. Nolan, we'd amend the minutes.
Very good. So with that one amendment, I'm going to call for a vote of the committee. All those in favor say aye.
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 Opposed? Kalisha, do I need to call name by name?
I think you heard Dr. Katz voted, and I saw Sally and Jose voted, so I have it on the record here.
So, Jose, would you get yes or no?
Yes.
Dr. Katz?
Yes.
Sally?
Yes.
Okay, it's unanimous. Then the minutes of January 12, 2021 are carried.
Hello. Before you
hello?
before you finish, it's a Jacqueline
Yes.
Narine on the line from Cumberland.
I'm sorry?
Did I need to take a vote on that too?
No, because the
No,
voters-
Miss Navarro.
the members of the Board of Health and Hospitals. But thank you for your amendment, and your amendment was
Sorry.
included. No, I'm glad you raised the question. Anybody who has a question along the way should raise that question. So your amendment was included in the final vote, which caused us to pass the minutes, in addition to your amendment, which indicated that you were at the meeting. Okay, so that's how we do that. When I put my reading glasses on, I can't read. Okay, I'm going to ask all of the board members, as I make my presentation, it'll be very, very brief. As was mentioned already, we have 4 hospitals that will be reporting to us today. As part of my report, I want to remind you of an event that's coming up over the next couple of months, which I believe is extremely important, and I know that you share in my feeling how important it is. Those are the annual meetings that we hold, and we're mandated to do that monthly. They will start on Tuesday, March 16th, which is in 2 weeks. It will be at Staten Island at Seaview. By the way, we expect these meetings will be held virtually unless we get word from the central office that it's safe enough and they're held together in body form. But right now, scheduled virtually March 16th at Seaview. The Manhattan meeting will be Tuesday, April 20th at Bellevue. The Queens meeting will be Tuesday, May 25th at Elmhurst Hospital. The Bronx meeting will be Tuesday, June 8th at Jacoby. And the Brooklyn meeting will be June 15th at Kings County. You're welcome to attend the meeting that occurs in your borough. You're welcome to also attend the meetings that we hold in the other boroughs. That's all depending upon your schedule. So if you feel that there's something you want to say, but you're representing a Queens hospital, let's say, but you can't make it that night, but you can make the Brooklyn meeting or the Bronx meeting, we welcome you. Now, please come on. If it's a virtual meeting, we welcome you. If it's at a location, we will welcome you there. Speakers are asked to register in advance by calling Ms. Felicia Hercules, who is the secretary of our board. You can reach her and get your pens ready at 212-788-3360. That's 3360. I expect every one of our hospitals and their advisory boards will be testifying. We'll have at least one person with something that they want to talk about. Your hospitals are welcome to have 2 or 3 people speak on different matters. We welcome that and certainly would like to hear from as many people who would like to tell us what the current conditions are at the hospital, how well they're doing, what you think they can do better, and we'd like to hear from you. When I see that some hospitals don't show up at all and ignore the hearings, it gets me really annoyed because I really think that these public hearings are extremely important. And as board members, these are meetings that I think that somebody representing your hospital should attend and should testify. I'd like to also add that, lastly, the appointment, the testing and vaccination are available at all NYC Health and Hospitals locations. And we're offering also vaccine appointments for those who are eligible per the state guidelines. For appointments by phone, get your pens ready. This is not a new number, but you might not have it. It's 1-877-829-4692. I'll repeat that again. It's 1-877-829-4692. That's if you or somebody else you know needs a vaccination and you meet the guidelines. Call that number and try to make an appointment. There's also an online appointment. Kalisha, let me ask you, has everybody received what I'm looking at or just myself? Just me?
Your report, Mr. Nolan?
Yes, what I'm reading from. Just me, right?
No. We can share it with the CAB members.
Okay, the online appointments can be made. There's a whole link, so I wondered whether I should read the entire link.
No, they can just visit the NYC website and the link would be there.
That's fine, because it could take another half an hour to read the whole link. So that is the end of my report. Now I'm going to turn the meeting over to the President of Health and Hospitals, Dr. Mitchell Katz. Dr. Katz, the floor is yours.
Thank you so much, Chair. Health and Hospitals is still very much focused on COVID, both dealing with the second resurgence. For the first time, we've seen the hospital numbers decrease within the second resurgence, but the hospitals are still at historically high census because, unlike in the first surge, patients have continued to come for other conditions, which is a good thing and shows they trust the safety of our hospitals. But it's meant that we haven't been able to have decreases to compensate for the increases in COVID cases. As well, we have only had limited success in getting additional nurses and intensivist physicians from registry because there's been such a high demand for doctors and nurses across the country since this time in the second wave. New York was not as hard hit as other parts of the country. So we are still very much caring for patients, great outcomes compared to the first wave, very low mortality rates. We're providing people with the antibody treatments, monoclonal antibody treatments, often in the emergency room so that people don't get sicker. When they come into the hospital, we're treating them with steroids, putting them in the prone position face down. We are minimizing the use of intubation, and all of those things are resulting in markedly lower loss of life than what we experienced in the first horrible wave. We are very involved in vaccination. We are doing vaccination in all of our hospitals and our federally qualified health centers as well. We are doing both first and second shots of both Pfizer and Moderna at all of the hospitals. The federally qualified health centers are all doing Moderna vaccination. In addition, Health and Hospitals is running 3 of the mass sites. We're running the site at Brooklyn Army Terminal, the site, Brooklyn Army Terminal, obviously in Brooklyn, the Bathgate site in the Bronx, and then finally City Field in Queens. We're also in Staten Island. The Vanderbilt site is a 24-hour site. So we are heavily involved in getting New Yorkers vaccinated. We believe that by vaccinating people, we will be able to prevent a further wave of COVID. We are also doing a number of events in conjunction with our labor partners, 1199 SCIU, the State Nurses Association, the Building and Construction Trade Unions, to promote vaccination. We also are, of course, continuing to do testing and tracing. We had more than 100,000 tests done on a single day for 3 days in a row in January. We continue to believe that testing with our ability to then quarantine or isolate people in the quarantine hotels that we have, keep them safe, keep their family safe, is what's keeping New York City from having the high rate of cases that was seen in so many other parts of the country. So we are very proud of that. On other notes, we continue to be very aggressive at recruiting for psychiatry positions. We recognize a huge part of our mission is mental health care. And as other private hospitals get out of this business because they feel that it's unprofitable or too challenging, we get deeper and deeper into this scope of work because we believe it's critical for mission and what we stand for. But to do that, we have to be able to recruit enough providers. We are heavily using telemedicine, both for the safety of our patients and to reach them in settings where it might be difficult to do in-person visits. And I also just wanted to note that we are very grateful to all of those people who've contributed to the Healthcare Heroes Funds, which has been providing fresh daily meals to healthcare workers on the front line, taking care of patients with COVID, recognizing that they often cannot leave the facility in order to get food. They have a limited amount of time. They need to be able to eat, so they have enough energy to go on taking care of their patients. That concludes my report, Mr. Chair, and of course, I'm always available for suggestions or for questions or other thoughts.
I
The
just
floor
have
is
a
open for any
question.
questions, Dr. Katz. Sally, you're recognized. Go ahead.
Yes, thank you. 2 questions together. One, do we anticipate receiving the J&J Johnson & Johnson vaccines and when? And 2, if we get them, will it make it more likely that we'll be able to vaccinate people who are homebound and unable to get to vaccinating facilities?
Yes and yes. We think that we will get J&J Johnson & Johnson vaccine in the city by Thursday of this week. Likely it will be one major shipment. They will ship out. The factories have been working, have produced a set of doses, and the city will get a large amount of doses, and it will be what we'll have for a few weeks. We want to use the vaccine, has several advantages. The biggest one maybe is one and done. We know that not everybody who goes for the first vaccine actually is able to come back for a second vaccine. With this vaccine, we'll be able to give it to them and know that they are protected from the really serious sequelae of COVID, which is death. This vaccine is every bit as effective at preventing death, which is what matters at the end. We as a society, we can survive people getting ill if they recover. We cannot survive the horrible losses of last year. So we think that besides the homebound elderly, or homebound younger disabled people, the other major uses for the vaccine, Sally, will be homeless shelters, inmates coming in for incarceration, because often we won't see them for a second appointment. And so this way, when they come in, they're going to be for a short sentence, or likely to be out on bail shortly. This will give us an opportunity to vaccinate them. Also using it for people who don't have a vaccine appointment but are in the hospital. They were in a traumatic accident. They had their gallbladder removed. They delivered a baby. It's a great opportunity to be able to give them a vaccine and know you don't need to find them for a second vaccine. So I think there'll be a lot of excellent uses for the Johnson & Johnson product.
Great, thank you.
Are there any other questions for Dr. Katz? Hearing none, thank you so much, Dr. Katz, for your update. I'd like to now introduce our Director of Intergovernmental Affairs. We have some issues that occurred at the last meeting that I promised you that we would have follow-ups to get you answers. So I want to introduce Kenfi Labardi, who's our Director of Intergovernmental Affairs, who will update the board. Kenfi, the floor is yours.
Thank you, Mr. Nolan. So just some follow-up from the January 12th meeting. We had some facilities that presented. They were East New York, Carter, Queens, Woodhull, Kings County, and Bellevue. So out of those facilities that presented, East New York and Woodhull were advised to provide additional details regarding the complaints, such as infrastructures and equipment. So the complaint from East New York, the most frequent reason was that patients were not necessarily getting through to the call center, and East New York leadership has informed the call center of the patient issues, and they will continue working with the call center. The Department of Patient Relations will continue monitoring patient complaints, and at the same time, they will escalate the issues that comes up as necessary to the executive team so that they can take further actions. Next facility was Woodhull, and the most frequent reason for patient complaints included waiting time, staff attitude, and property loss. So in terms of what Woodhull has done about this issue, they formed a lost property subcommittee that is working to streamline the better workflow. Inpatient nursing, patient escorts, emergency department staff, they've all been trained on conducting property check and documenting them in Epic. The process is hopefully going to ensure accountability and real-time recovery of property and valuables. They've also seen a reduction in the number of properties and valuable complaints over the last 4 months, which, to our understanding, it could be validated by the patient relations and the grievance committee. The emergency department wait time has improved throughout the third and fourth quarter of 2020. The provider in triage model was introduced to decrease wait times and reduce the number of patients leaving without being seen. The median door to triage time is consistently under 15 minutes, and the median door to doctor time has improved by more than 30%, which was from 65 minutes to a reduction of 42 minutes. And the overall emergency department length of stay is approximately 3 hours, and the length of stay for the fast track is 2 hours. I believe the fast track is a different program as well. And lastly, the adult emergency department, they have also increased the age criteria in the pediatric emergency department from 18 to 25. So those were the two complaints that came out of the last meeting on June 12, and to the best of their ability, these are the responses that we've received so far.
Oh, Kempy, thank you very much. Is there anybody on today's meeting, either from East New York or from Woodhull? And if you are, please identify yourself and please let us know whether those responses from this office were satisfactory. Is there
Hello,
anybody on East New York?
this is Julissa Herrera from Woodhull.
Oh, hi, Julissa. How are you?
I'm doing well. Thank you very much, Mr. Nolan, everybody who is able to attend the meeting today. I'm very happy to hear of the follow-up to the concerns that were cited by the community regarding Woodhull, and I'm very inspired that moving forward, they are being addressed, which is, along with all the challenges that are being faced right now, it's something that does make a big difference and helps regain the support of the community. So I really would like to say thank you once again.
On behalf of everybody, thank you very much. You're welcome. And we want to be responsive. We want to make sure our answers we get back to you are responsive to you. And if there are any issues that come up since we meet every other month, please don't wait 60 days to call us. Call O'Kempy. He's the Director of Intergovernmental Affairs. If an issue comes up tomorrow, call him tomorrow. Don't feel that you have to wait. Just call him with an issue that you have, and he'll try to help you as much as he can. That goes to every one of our hospitals that are on the meeting today. And if you run into any of your colleagues from the other hospitals, please let them know. No, we don't wait 60 days or 30 days or a week. We take care of things immediately, and that's the goal here. And I want to thank O'Kempy for making that possible. And we will continue to try to get that information to you as soon as possible. We won't wait for monthly meetings. We'll announce it like we've done today. This, I think, is one of the first times in a while we've done that. But I'm sure O'Kempy will get back to you as quickly as he can with his resolution of the matter.
So
Thank
much,
you.
Nolan. Thank
Is
you.
there anybody else on the board? Is there anybody on the meeting from East New York? Okay, then O'Kempy, we're going to count on you. Did you already speak to East New York?
Yes.
You did. Was their reaction to with the work that you've done? Were they satisfied?
Taking off my mask. Yes. From the report that I read earlier, I think the issue had to do with the fact that the calls were not necessarily getting through in the call center. And so the leadership have informed the call center in terms of the patient issues, and they are working with the
I
call center.
understand. I want to know whether the person who called you, this came up at our meeting, did you call back the person from East New York to speak to that person individually to let them know how you responded to that?
Well, I don't think
If you haven't, please call that person, whoever the cab rep is from East New York. I don't have my master list in front of me. Call that person tomorrow and just let them know what your response was and that you want to make sure that they knew personally that you responded to the issue.
Oh, yes, absolutely. Will do.
Wonderful. Thank you so much for your report. I'm going to move on now for our information items, the report from our 4 hospitals. And as you see on the screen is a report from Seaview. I'm going to introduce Joe Torello, who's sitting in for George Marino out there at Seaview. And I asked Mr. Torello to give his report. Mr. Torello, can you hear me? Going once, going twice. Kalisha, do you suggest I move on to Coney Island?
Yes, Mr. Nolan, please move on to Coney
Okay,
Island.
so
We'll
we'll
come back to him.
Introduce Teresa Scavo, representing Coney Island, and ask Teresa to give her report. Hi, Teresa.
Hi. Good evening, Chairman Nolan, Dr. Katz, the Health and Hospital Board of Directors, and my fellow CAB members. My name is Teresa Scavo, and I'm the chairperson of Health and Hospitals Coney Island. This past year, living through this pandemic has been a horrible experience for all of us around the city. Today, Coney Island has been the hardest hit hospital in the H&H family located in a Brooklyn zip code with the highest positivity rate of 15.14%. In just 10 short days, on March 12th, Coney Island will be remembering the 1-year anniversary of the first positive COVID case at Coney. During that time, there were over 114 ventilators in use. When visitation was suspended, there were over 300 contact phone calls a day, whether via Skype, FaceTime, or just a phone call, facilitated by the comfort team and the patient relations workers. What we learned from phase 1 helped us to prepare for the eventual phase 2. With lessons learned, we improved both staff and patient safety while utilizing every available space in the hospital. Today, we are educating, performing test and trace, and administering the vaccine. As far as our infrastructure, our new critical services structure is projected for occupancy in June of 2022. The main building will be reimagined with a state-of-the-art facility for ambulatory care services. We are always prepared for trauma cases, but after many years of advocating for a level 1 trauma center, the city is saying the costs to maintain it are prohibitive. But we still advocate daily for a level 1 trauma center at Coney. Coney is now performing interventional cardiac procedures. As far as complaints, right now, complaints are focused on visitation of loved ones. Not being able to visit is angering many family members. As far as issues impacting our community, questions asked are, how do I get a COVID vaccine? How can I get an appointment? The waiting time is angering many patients as well as people in our community. But at Coney, we are doing outreach to contact all of our patients, as well as reaching out to all the seniors in our community. Thank you and good evening.
Thank you very much, Mr. Scavo, for your report. As you told me earlier, the construction of the new Coney Island Hospital should be completed by June of 2022, correct?
Correct, yes.
Okay. And the issue, of course, that's angering your community is angering every community across the city, not having enough vaccines. I think at this point we have more than enough actual locations, but getting that vaccine, which, as you know, comes from the federal government to the city, to the hospitals and the other places than that.
Correct.
When you have those people like that, I know that your CEO is on the phone. Is she able to be of any help, Svetlana? Could you answer that? What direction can you give to Ms. Scavo and other people who are part of the CAB at your own hospital, Coney Island, as to what they should be doing in order to get that vaccine?
Well, we're working very hard to prioritize our seniors and our patients. So we've been actually reaching out proactively to those individuals to make sure that we're able to schedule them and to give them appointments that really that meet their needs. It's very challenging for seniors, especially our super seniors, of which there's quite a number in our community, to use the online tools. So for those who have not been able to be reached out to, we do suggest that they call the phone number, which you mentioned earlier in the meeting. And we have been working with our CAB members and our electeds to schedule those members in the community who aren't able to use the tools that are available. We've also done some tabling to collect names from seniors to make sure that those who need it are able to be prioritized. It's very difficult. There's a lot of demand, but we are working very hard to make sure that our patients and the elderly are able to get appointments when they need.
Well, thank you very much. I know that you're working hard. I feel that this responsibility falls on the CEO and in this case, your staff, to be as helpful as you possibly can be, and you're doing that. I know there have been a number of improvements in the last week or so. I'm hearing that this Walgreens, where I live in the Bronx, I'm president of the senior center. We had our monthly meeting yesterday, and two seniors told me about that Walgreens over there is open, and they're giving out shots, and that CVS is open over there, and they're cumulatively, they're coming up with other locations nearby. And this is about, their location where they meet is about two miles from Jacoby Hospital. But so it's working out, but people are finding other locations that the shots are available, either state locations or places like the pharmacies, or surprise, surprise, your own doctor. That we found out that a couple of people were surprised when they called their doctor and said, I don't know what to do. I can't get the shot. And the doctor said, come and see me. I have vaccines. So we are doing all we can do. And I thank you for doing all you're doing down there in the southern part of Brooklyn at Coney Island, because you have a huge geographic area to cover before you come to any other city facility nearby. So thank you very much, Svetlana.
Thank you.
Are there any questions from any of my fellow board members of Coney Island and Moscow on her report? Hearing none, I'm going to move back. I'm going to call our friends out in Staten Island and see whether they are back yet. Mr. Joe Torello of Seaview. Mr. Torello, are you on the call?
Hi, Mr. Tonello may not be on the call, but this is Matthew Levy. I'm the CEO at Seaview, and I'm on the call.
Oh, Matt, welcome. It's good to hear your voice, and thank you very much. And are you prepared
Sure
to give the reporter an update?
Sure. Yes, I'm prepared to speak on behalf of Seaview. Absolutely.
Go right ahead. The floor is yours, Matt.
Things at Seaview are going very well. COVID certainly presented with its share of challenges, but all in all, most importantly, our residents are doing well, and our staff are doing well as well. Continue to do well. We're testing our residents and our staff on a weekly basis. Our staff gets tested for COVID-19 twice per week, as our residents are tested weekly. Currently, we have 2 residents in our facility with COVID-19, and thankfully, they are asymptomatic and are doing well. Our vaccination program was put together in conjunction with help from our vendor pharmacy, FarmScript. FarmScript came on site for 3 different clinics and managed to immunize over 200 residents and over close to 175 staff. We are working diligently with FarmScript to see when we can schedule additional clinics so we can finish our vaccination program. Our staff is in addition to that, we've had multiple Department of Health inspections, focused infection control surveys, all of which have been extremely successful and yielded 0 deficiencies. So we're really proud of that, showing that throughout this process, we've been, maintained that we've been highly regulated and adhering to all infection control protocol. Our resident satisfaction remains at a high number. We are working diligently to keep our families engaged. As a facility, we hold a weekly COVID-19 town hall meeting with our staff and with our families, and we get over 100 families on that call, and they're given an opportunity to speak with me for about a half hour, and we go over what's going on with the COVID climate and how we can improve anything at the facility level that needs our attention. So we're very happy with how things are given the circumstances. We're looking forward to brighter days ahead, and we are very appreciative for all the support.
Thank you very much, Levy.
Mr. Nolan, can you hear me now? This is Joe Tornello from Seaview.
Hi, Joe.
Hi.
Hello.
Did Levy give the report just now?
Yeah, I heard. I was trying to, I logged in the very beginning, and you heard me, and I listened to the whole meeting, and when you called my name, nobody could hear me, so I logged out and logged all in again. So,
okay.
And I was listening to Matt, and I really,
Joe,
I apologize for the technical problems here, but I've been listening to everything going forward.
Joe, is there anything you'd like to add to what Mr. Levy had to say?
No, just to apologize that I wasn't able to, I have my
don't
report.
apologize. 2021, this is the Zoom system. Sometimes we have sound that works, sometimes we have sound that does not work. I had 7 Zoom meetings covering not just health and hospitals, but all other areas where my involvement. And sometimes I'm heard, and sometimes I'm not heard. We have to make adjustments for that. We're all living with it. So,
Yeah.
so we
Well, in any
appreciate
case, I do want to say that the CAB, we are very, very fortunate to have had as our CEO, Matt Levy. He's done a tremendous job, great leadership. I know the staff and the residents have certainly benefited from his leadership, especially over this very trying year that we've gone through. And so, I'm glad Matt's on the phone there to be able to say that about him and to be part of the Community Advisory Board. I was a past chair. Currently, today, I'm filling in for George Marino. And again, I apologize for the technical problems on my end, but thank you very much.
No need, but thank you very much.
Bob, it's Sally. I have
Yeah.
a question. Yeah.
Go ahead.
What are the rules now in terms of visitation at the post-acute facilities? Is it not allowed at all? Under narrow? What are the rules?
That's a great question. So technically, under the guidelines furnished by the Department of Health, facilities can open for visitation once they've met the 14-day requirement, which means that over the last 14 days, there's been no signs of infection from staff or residents. Once that qualifying event has occurred, then under certain guidelines, the facility can reopen. Those guidelines include a limited number of people in the building. Depending on their zone, Staten Island is still in a zone that would require visitors to furnish a test. Some of our other post-acute sites are in areas that do not require testing, although strongly encouraged by the Department of Health. It's not recommended. It's not required. So once those parameters and qualifying items have been met, the facility can open up for visitation. Now we're fortunate enough that we're starting. If things go according to plan, Seaview will be resume visitation next week, which will be great. I know our residents are really and families are looking forward to that. In addition to in-person visitation, we maintain our electronic visitation, which includes FaceTiming, use of equipment to assist with virtual visitation, as well as window visits, which have been, believe it or not, very helpful. Families, although separated by a pane of glass, have the opportunity to see their loved one on a weekly basis, and I think that's helped take the edge off a little bit.
Yeah, that's an interesting innovation.
It's not great, but it's better than nothing. And after the year that our residents and families have been through, certainly it's something that we try to accommodate the best we can, including evenings and weekends.
Thank you.
Thank you.
Are there any other questions from board members? Hearing none, I want to thank the Seaview leadership, both Mr. Levy as well as Joe Paternello, for their reports and their comments. Excuse me? I'm going to move on to the Belvis report, Gotham Health Belvis Medical Facility in the Bronx.
Yay.
Mr. DeJesus,
evening.
are you on?
Yes, do you hear me?
Yes, I can. Welcome.
Oh, thank you. Thank you very much. Good evening, everyone.
Good evening. You've got the
Thank you
floor.
for the opportunity to address the Belvis report. So I'm gonna just get right into it. So Gotham Belvis has been able to test over 30,000 patients since the beginning of this pandemic. It's been very trying. These numbers reflect both testing location and mobile testing. For the mobile testing van, the clinical team provided patients with the most updated information about pandemic and educated them on the importance of getting tested. So we're getting people walking in on a daily basis in the back of Belvis with the tent and getting their tests done. Vaccinations, Belvis is currently vaccinating upwards of 80 patients daily with the COVID-19 vaccine. We hope to increase those numbers as time goes by.
We continue to upgrade equipment as necessary to ensure that staff is equipped to perform their jobs effectively and efficiently. Modernization of both elevators as a capital project have been approved by the executive leadership. The pharmaceutical freezer, refrigerator, and industrial freezer installed in the pharmacy to house COVID vaccines at the appropriate temps have been set. Body temperature cameras being installed for quick, accurate temperature readings at the facility entrance for all patients and staff entering the building. We also are giving temporary sneeze guards installed throughout the building to protect both staff and the patients. Cell phone charging and sanitizing stations have been installed for patient and staff use in the waiting area on the first floor. Most frequent patient complaints is having to wait for vaccine appointments. And during the COVID-19, patients expressed their satisfaction with the care provided by Gotham providers and staff. As you know, the Bronx suffers from a high asthma rate, so we've been dealing with that for many years now and trying to tackle it. Community Affairs has distributed over 7,000 flyers to residents, New York City housing authorities, small businesses, and community partners on the importance of getting COVID-19 testing done. We want to do a special thank you to Dr. David John, CMO of Gotham Health, for his effective and continued leadership at Belvis Gotham. We also want to thank Ms. Michelle Lewis, CEO of Gotham Health, for her continued support of the Belvis Gotham staff, and all staff, especially Community Affairs and the Belvis Gotham leadership, for their input in making 2020 a successful year despite the challenges faced with this pandemic. And that's the Belvis report for tonight. Thank you.
Thank you very much, Mr. DeJesus. Are there any questions from my fellow board members? Mr. DeJesus, you should know that the complaint about the impatience, people waiting for their vaccination, is a very common one. It's not just across the city, it's across the nation. And all we can do is ask your patients to hang in there as best as you can until we get a larger amount of vaccine that's coming to us. We're all hearing about more vaccines coming in March and a greater number coming in April. And we certainly hope that that will be the case.
Thank you so much. Thank you so much. We'll make sure that I let them know that.
And I want to congratulate the Community Affairs Unit. I don't remember the last time I saw 7,000 flyers circulated for anything. But the fact that 7,000 flyers, and if they've done that over the last couple of months in the cold of winter, is above and beyond the call of duty. So congratulations for those staff members who were out there dropping all those flyers, because believe me, I know what dropping flyers is all about. So
thank you.
I want to thank you for your report. Again, are there any other questions from board members? Hearing none, I want to thank Mr. DeJesus. Now I'm going to move on to our final hospital report for the evening from Arsenia. Is Donna Hill Young on the line? Donna Hill Young, the Community Advisory Board member from Arsenia. Kalisha, do we know whether she checked in or whether she's on the line or anywhere?
She has not checked in yet, Mr. Nolan. I think you should call her a couple more times and then we can move on.
Okay, so you're suggesting I call for Miss Donna Hill Young again to report on behalf of Morrisania. I know Morrisania was one of the first hospitals in the Bronx that was selected to give out vaccines, as Dr. Katz and I went through that some months ago. And the expansion into Morrisania was really a terrific thing for the community. But once again, I'll call for Donna Hill Young, and if we don't hear from Donna, then we're going to move on. Okay, not hearing Donna. I know, Kalisha, you'll follow up with Morrisania, and we hope to hear from them at our next monthly meeting. And I'm going to move on to, is there any old business? And if I don't hear any, I'm going to ask for any new business. So we're at the old and the new business state of our meeting at about, let's see, about 11 minutes of 6. So any old business? Is there any new business? Is, for no more than 2 minutes, is Dr. Andrews on the line? Is he able to join us tonight? Dr. Anthony Andrews. There you are, Anthony.
I'm here, Bob. Hey, Bob, how are you?
You got 1 minute. Is there anything else that we need to know? Since you are the chair of the various CABs for the council, is there anything you'd like to know for, let us benefit by, that you can update us on?
No, nothing at that point, or nothing I should say at this point. If at some point we do, we'll make sure that we bring it to you before the next meeting.
Thank you very much, and good luck to you on your meeting that follows. Hearing no old business and no new business, and the brevity of Dr. Andrews' report, I will then call for a motion to adjourn the meeting.
So moved.
Is there a motion? And it's seconded. We are adjourned. Thank you very much. Please, those of you who represent the various hospitals, stay on because you've got a meeting that follows us. And please, if anything comes up, don't wait for our next meeting in 2 months. Call the central office, call Anthony, call us, call our intergovernmental unit, and let us know what's on your mind. We don't want to wait until May to hear something that's really, really important. If it's important and you remember it in 15 minutes, call Okembe and get that message to him so we can be in help in some way. With that, this meeting is now adjourned. I wish you all well. Happy holidays that are coming up, and happy warm weather tomorrow, 50 degrees. So we'll benefit from the joy and happiness of it being 50 degrees. Good night to all of you.
And thank you, Mr. Nolan. For those of you who were joining the subsequent CAB meeting, please note there is a separate WebEx that was sent out to you. So you're welcome to stay on this link, but you won't have anyone to talk. Thank you.
Thank you, Dan.
Thank you.